Welcome to POC Nurse. Today we're discussing cardiac assessment questions for the CCRN exam. Our first question goes like this. Your patient tells you he has aortic stenosis. Where would you listen for the murmur of this condition? A. Second intercostal space, right sternal border. B. Second intercostal space, left sternal border. Or C. Fifth intercostal space, mid-clavicular line. Let's dive into the knowledge we need to answer this question. So, there are four areas on the chest where we listen for murmurs, and they correspond to the letters A for aortic, P for pulmonic, T for tricuspid, and M for mitral. Now, I usually try to remember these letters using the mnemonic all patients take medications or all physicians take money. Now, the letter A is positioned on the right side of the chest, while the letters P, T, and M are on the left side of the chest. So, for the letter A, we're listening for the murmur of the aortic valve, and we listen at the second intercostal space, right sternal border. On the opposite side, we have the letter P, which corresponds to the pulmonic valve, and we listen for the murmur of the pulmonic valve at the second intercostal space, but on the left sternal border, on the opposite side of where we would listen for the murmur of the aortic valve. For the tricuspid valve, we listen at the fourth intercostal space, left sternal border. And for the mitral valve, we listen at the fifth intercostal space, mid clavicular line. Now, I think this is important because I think when I took my CCRN exam or when I was doing practice questions, I got one question on listening for a murmur. I think the question was very straightforward, like, where would you listen for the murmur of XYZ? And the choices were similar to what we're talking about here, exactly where you would listen, but jumbled up in a sense. So it's important to know what point to listen at. And this is the kind of knowledge that you pretty much memorize, which is why the mnemonic is very helpful to me. All right, let's move on and answer the question. By now, we should have our answer because at A, we listen at the second intercostal space, right sternal border. At P, we listen at the second intercostal space, left sternal border. And at the letter T, we listen at the fourth intercostal space, left sternal border. And at the letter M, we listen at the fifth intercostal space, mid clavicular line. Let's see what the answer is. So the answer is A, second intercostal space, right sternal border. That is where you would listen for the murmur of the aortic valve. And the murmur could be stenotic in nature or it could be regurgitant in nature. You will still listen at the same place. Let's do a few more questions. So this question says, where would you listen for the murmur of mitral valve regurgitation? And the choices are second intercostal space, right sternal border, fifth intercostal space, left sternal border, or fifth intercostal space, mid clavicular line. What do you think the answer is? Let's find out. So the answer is fifth intercostal space, mid clavicular line. That is where we would listen for the murmur of a mitral valve using all physicians take money and going by their corresponding areas. We know that this is the right answer. Another question here is, where would you listen for the murmur of pulmonic valve regurgitation? The choices are second intercostal space, right sternal border, second intercostal space, left sternal border, or fifth intercostal space, mid clavicular line. Using the mnemonic, all physicians take money or all patients take medications, we know the letter P corresponds to second intercostal space, left sternal border. What do you think the answer is? Let's check. So the answer is second intercostal space, left sternal border. This is where we would listen for a murmur of the pulmonic valve. Moving on to our last question. Where would you listen for the murmur of tricuspid valve stenosis? The choices are second intercostal space, right sternal border, fourth intercostal space, left sternal border, or fifth intercostal space, mid-clavicular line. So we're talking about the tricuspid valve, the letter T, using our mnemonic, all physicians take money, or all patients take medications. The letter T corresponds to the fourth intercostal space, left sternal border. Let's see if that's our answer. So our answer is fourth intercostal space, left sternal border. This is where we would listen for the murmur of the tricuspid valve, whether it be stenosis or regurgitation. This is where we would listen. Thank you for watching this video. If it was useful to you, please like, share, and subscribe. And please join my email newsletter. The link is posted beneath this video so that you will be notified anytime I post a new question or anytime I post a new audio guide. I will try to post a video a week. I will do my very best, and I wish you all the best. Bye bye.